be made available for further use, and I believe also will be posted on urbangoodpractices.org. So with this, I would like to pass the floor to Jordan. Kate, you're unmuted.
Thank you very much.
Okay, I'll actually just sort of introduce a few words and firstly say thank you to everyone who's joining in. I can also see that Alex Tyler is on as well, and so that's great because Alex and Kate have been very much the drivers with our key partners of the Vulnerability Assessment Framework. And I've got Nicole from WFP obviously being a key partner on that line. How we've got to place the Vulnerability Assessment Framework is in the context of the overall refugee response in Jordan. And while the major camps such as Za'atri and Azraq often get the most attention, what we found is that 85 to 90% of the refugees that we have in Jordan are actually in the urban environment. Largely anonymous, often difficult to reach, and increasingly vulnerable because they often don't have access to the support mechanisms which people have in camps. So what we've been doing from the outset is making sure that we have a very robust registration system in place, something which I think is very advanced as well. We've put in place a biometric-based registration system utilizing iris scanning, and as the key baseline in which we've been able to undertake further studies of the refugee population. We've then supplemented our understanding from those interviews with home visits. We've undertaken about 170,000 home visits to assess the vulnerability, and part of those home visits have fed into the formulation of this vulnerability assessment framework. What we haven't put forward here, but I think is also extremely interesting, is we've also established a minimum expenditure basket, which is the level which we believe refugees require in order to survive in an urban environment. And that is then fed into our cash assistance program, where we're also using biometrics through ATMs to ensure that the targeting and the provision of support is both efficient and effective. So I won't go too much further other than to say that I think this is an incredibly important initiative which has come out of Jordan. One of the key aspects is it's not just the UNHCR initiative, it's very much a partnership with other key agencies, including WFP, but also the NGOs. And to make this work, we also had to have the buy-in of the donors. And both the European Union through ECHO and the US have been key supporters of it. And now that we've got the buy-in of the donors, key operational partners and the NGOs, then this is now becoming the default. People should be applying the VAF to the selection criteria for people for assistance, for all refugees for assistance. So it will be used, and Nicole will be able to talk about in a few slides about how WFP is using it, and we're seeing it right now why it's so important, because funding is going to become increasingly tight, and we have to enhance the targeting and prioritization. So even before the donors asked us to do this, we were already a step ahead in having an interagency collaborative approach to that. So on that basis, I'll now pass on to Kate and Nicole.
Great, thank you very much, Andrew. Good afternoon, everybody. So as Andrew said, I'm going to talk you through the development of the Vulnerability Assessment Framework in Jordan. I'm going to talk for probably about 20 minutes about where the framework came from, the ideas that fed into it, and what we were trying to do with it. I'll also talk about what it involves and some of the technical aspects and the maths and the modeling that sits behind it. We will then have an opportunity to have a look at the baseline survey that we produced on the basis of the framework and some of the analysis that came out of that. in that part of the session, we'll be able to look at what we can actually do with this framework, look at the mapping that's available, and think about how that can be used to improve programming. Nicole will talk a little bit, as Andrew said, about how WFP and other partners are able to use this information to inform their targeting and their assistance provision. And as a parallel to that, also the importance of having an appeal system and our experience from running an appeal system here in Jordan. And then at the end, we'll take questions. As Attila said at the beginning, if there are clarifications or things that are not clear whilst we're going through, we can take questions during the session. But in general, I see we've now got 96 participants. We'll not take questions going through unless it's something particularly pertaining to a point in the presentation, but leave those questions to the end. Okay. So as Andrew said, this is really a very collaborative effort, and I think that's something that we really want to stress. This is a process that involves a steering committee of 5 UN agencies, you can see them there at the top, 5 INGOs, and the 2 donors. And that steering committee was very instrumental in making sure that we had the buy-in of the community, that we had different voices being raised through the process. And this allowed us to discuss a lot of the details. And the devil has really been in the detail of this process. And you'll see why when we go through. But having all of these different agencies involved allowed us to make sure that we were thinking about all of the different aspects and making sure that we were going to be responding to the needs of refugees. In the beginning, and this process began really, or the process that sat behind this process began in 2013. And it was as a response to the very large numbers of urban refugees that we were seeing here in Jordan, and the need to be more efficient and more effective in providing assistance to those refugees. We had lots of different agencies operating after the initial emergency phase. Things had begun to stabilize a little, and we needed to make sure that our efforts were coordinated, collaborative, and consistent. And this is really about making sure that refugees don't get multiple visits from multiple agencies without being provided with assistance, and that different agencies know what other agencies are doing. Also, in terms of effectiveness, what we were looking at is different aspects, and this is where, when we were first talking about VAF, people were saying, well, what is that? What does it mean? What are the components that sit in that? And we found that different people had different ideas. Now, one of the things that it is definitely a coordination framework. As we said at the beginning, we will talk later about what it means in terms of an appeals framework. It's also an analysis framework and allows us to really look at where there is vulnerability within the Syrian refugee population and then track that over time. And then ultimately also a targeting framework which helps us to ensure that the most vulnerable are those who are receiving assistance. Another thing that when we were first talking with different agencies and different actors about this was a concern that this was just about a reduction in funding. It is definitely something that was developed as a response to the idea that we were anticipating levels of funding would be going down, but that was not in and of itself the purpose. The purpose is to ensure that those people who are most in need of assistance are the ones receiving it. And this is good programming and aid efficiency. And so what we're seeing in the slide here is really the idea behind the framework is to make sure that those who are at most risk are the people who are getting the most assistance. How did we do it, and where did we start? So at the beginning of 2014, which seems like a very long time ago now, the steering committee came together, and we started discussing what this would look like. And one of the things that came out of that discussion is that this word vulnerability is something that we use as humanitarian actors a lot, but the different agencies and different actors have multiple understandings of that. So one of the first things that we needed to do in order to be able to be consistent was to have a common understanding and a common definition of vulnerability. And what you're seeing up on the slide in front of you there is a definition of vulnerability that was devised through an interagency, intersectoral workshop where actors came together to discuss what does it really mean when we're talking about the vulnerability of Syrian refugee households. And there are two two aspects of this definition here. One speaks about the protection threats and the inability to meet basic needs and live dignified lives. And the other side is the ability of the population to cope with the consequences of this harm. And this is really the definition that sits behind all of the vulnerability assessment work that we're going to look at now. So having come up with a definition of vulnerability, we then needed to think about how are we going to collect information on this. In Jordan, we were very fortunate. We already had an established UNHCR home visit methodology where refugees, when they register with UNHCR, are very shortly afterwards visited by UNHCR's partner in the field, and a home visit is conducted. So there was a survey methodology already in place. We then, through that initial workshop, talked with different agencies and, as I said, different sector members and actors about what vulnerability by sector meant, with a view to creating a questionnaire, so with a view to coming up with a vulnerability assessment tool. In that workshop, each sector was asked to identify indicators of vulnerability that pertain to their sector. This could be anything from, for example, for the education sector, identifying that the number of children out of school would be an indicator for education. For food, there are the various different food consumption scores and methodologies for collecting data on vulnerability. For shelter, the quality and the standard of the accommodation and where people are living. So each sector identified indicators, and a questionnaire was then developed. This questionnaire was then incorporated into the UNHCR home visit form, and simultaneously it was deployed through the ODK, that's the Open Data Kit system, of which you're seeing a little picture there on the right. So we're using this very up-to-date technology, which allows information to be collected live in the field and put into the data collection unit, in this case the tablets. To date, we have been able to interview over 65,000 cases through this methodology. So it's about 5,000 cases a month. And that information is directly uploaded from the ODK unit into an ODK server, and then ultimately the data is housed within RISE, which is the Refugee Assistance Information System. And that is the system that's used throughout the Syrian response countries. Having come up with a questionnaire and then rolled it out and started collecting data, we then worked out that we needed to have a system for analyzing that data. So simultaneously, whilst the questionnaire was being rolled out and piloted, there were a couple of other things that were happening. One, we took that definition of vulnerability, and we had over 60 consultations with refugees, to the Syrian refugees, to discuss what they thought were indicators of vulnerability. We also had the World Bank come and do some analysis of the UNHCR home visit data and UNHCR cash assistance data, and they used an econometric model, so a statistical regression modeling system, to analyze that data and to be able to think about and look at predicted welfare. The World Bank uses predicted expenditure as a proxy for welfare, and they were able to do that looking at the UNHCR home visit data and UNHCR registration data, and then also looking at and applying the data related to those cases and families that were being provided with UNHCR cash assistance. We then took the VAF data, so the actual data collected not through the home visit forms, but the initial home visit forms, but through the home visit forms which incorporated the vulnerability assessment framework questions, and analyzed that data using the same system, using this econometric analysis. So this is a system which looks at, it's a mathematically based model, and it's based on statistical regression. It uses observable facts, so it is the study of observable facts. And it allows for the identification of correlations with specific values in order to create a predictive formula. I'm going to show you in just a second what the math looks like, which is always the bit that I find really scary, but it's quite sophisticated and probably won't make that much sense until I can show you what it looks like, which is in a couple of slides' time. In parallel to that, we also then went back and talked with the sectors and talked about how we would analyze sector information. And for this, we were then looking at a different methodology, and this is theoretical hypothesis. Theoretical hypothesis is building out on applied expert knowledge, so the knowledge of those sector actors. It's the application of the theory and experience, the multiple assessments that have been conducted at the sector level. And it builds on known links of causality. And this is used then, and you'll see what I mean in just a moment, this is used then for the creation of a model based on an algorithm. On the left there, you see the math. In a minute, it will make a great deal more sense to those of us who are not technically math people or statistical people. But just believe me, that makes a lot of sense to those people who can read it. And on the right, we have the theoretical hypothesis. This is a draft version of an education vulnerability tree. And there you can see we have different indicators. For example, the number of school-age children, risk factors for school attendance, economic vulnerability, dependency ratio, etc. And these were all indicators that were picked out by the sector actors as being indicators of vulnerability. And then they're all given scores from 1 to 4. We'll see some more of these sector-based theoretical trees in a moment, but in all instances we're using 1 to 4 as the threshold for vulnerability, 1 being mildly vulnerable and 4 being severely vulnerable. So here we have the econometric modeling on the data collected. So for the statistical modeling is used to develop and predict case-level expenditure. So if we're looking at a household or a case of a family of 4, where we have 1 adult, 2 children, and 1 elderly person, using this methodology, we will be able to predict what that family's per capita expenditure per month is, and then rate them within a threshold to be able to assess whether they would come out as being severely vulnerable, highly vulnerable, or moderately vulnerable, or have low vulnerability. That methodology uses 11 different variables from the survey, and it's something that, as I said, we worked on closely with the World Bank. Here you have the sector tree again, and this is a different version of the same thing. We're looking at the education vulnerability tree there on the right. So the sector level scorings were initially drafted, and we then looked at the different data points within the VAF questionnaire. There are over 600 data points available, and those are the things that the sectors were building their trees out with. We did an initial analysis, so each sector developed a tree. We then took the tree and applied it to the vulnerability assessment data collection, and looked at and did some analysis of the frequency with which the different data points that the sectors had identified were being recorded. For example, in the education, one of the things that the education sector identified was child labor being a risk factor for education. Now, whilst that was definitely true, and the sector analysis on that was very strong, when we actually analyzed the VAF data, that was not being reported by families with the same level of frequency that the sectors would have predicted. And there are many reasons for this, and this relates to data collection methodology and the fact that perhaps families, when they have receiving a home visit, may feel insecure about saying that their children are, for example, involved in child labor. So we went back to the sectors, and for each sector went back with this analysis of the frequency of data points and said, is this analysis in line with your sectoral analysis, and do you want to include this in your sector tree? And if you do you wish to weight it in the way that you have initially weighted it? So in some cases, in instances of child labor, for example, we might have advised to weight it more highly than another factor because we were getting potentially under levels of reporting. So the sectors then reviewed and revised those sector trees. At the bottom of the screen there, you're just seeing the evolution of the VAF process and the different steps as we went along. This is another example of a food vulnerability tree. What you're seeing there on the left-hand side is the atomic indicators. In the middle there, the composite indicators, and moving through to the right, then that becomes the food vulnerability, or sorry, the food security vulnerability score. So the food security sector identified dependency ratio, single-headed households as being factors that contribute to social vulnerability, and then we have the food consumption score, the expenditure on food and livelihood coping strategies building into the carry there. This one is the sector score developed by the basic needs sector, and you can see there that the basic needs sector identifies coping strategies, dependency ratio, and economic state as being the factors that feed into basic needs, with total debt per capita and total expenditure per capita feeding into economic state. In each instance, so each different sector decided whether they were going to use maximums or averages and what the mathematical formulas were that sat behind their sector trees. And the VAF team worked with each sector individually in order to develop these trees. I'm just going to stop for 1 second there. Is everybody still with me and everybody okay? Anybody who's not okay, I think you can raise your hand and Attila will tell us, but I hope I haven't gone through that too fast. What I'm going to talk about in a minute is then what we can do with this and what it looks like. Okay, we're going to assume everybody's okay. So the next slide is looking at predicted welfare, and this is the kind of analysis that we can do based on the different components that they make up predicted welfare. This is a draft slide. This is not live information. I've just put it up here for demonstration purposes. But within predicted welfare, there are different aspects that build that out. Those are the characteristics that are identified through the statistical regression modeling. And at the bottom there, you can see they're broken out. In the slide in the middle, the table in the middle, that is the overall predicted welfare. And here, in this instance, and really this is draft information, this is not demonstration information, what you would see is, for example, 58% of cases, which represent 79% of the population, are living below the Jordanian poverty line. And underneath there, you can see the different characteristics that build up to that predicted welfare VAF rating. If we look at another one for one of the sector trees, here we have food security. And here we're seeing the different aspects that make up food security, so the dependency ratio, the head of household, the type of diet, and the proportion of budget that's being spent on food. What we see is the demonstration results here, 77% of cases rated highly or severely vulnerable, which represents 86% of the population. But underneath, for each of the sector trees, you can then pull out the different aspects and do that kind of analysis. So in this one, for example, we see the social vulnerability rating. We had 34% and 35% respectively falling into the severely vulnerable and highly vulnerable categories. What does that all mean, and where does all of that take us to? Once we had done all of this analysis and we'd gone back to the sectors and we'd looked at our trees and looked at the initial analysis, we realized that one of the things that we would need to do, and this is very important for anybody who might be thinking about replicating this exercise elsewhere, is to have a representative randomized baseline survey As I said right at the beginning, the home visit methodology, something technical is happening. The home visit methodology is based on refugees having registered with UNHCR, and then very shortly afterwards they receive a home visit. The other entrance points for a home visit are referrals from other agencies, reassessment for cash assistance, or people being referred for protection specific reasons. So this is a biased sample. So although we had over 40,000 records collected, we understood that our analysis would be being biased towards those who are most vulnerable. Therefore, we conducted in January and February of this year a randomized representative sample across Jordan of Syrian refugees. And we did two different things. We did a geographical sample and a gender sample. So for the geographical sample, we looked at 4 different areas. We looked at the north of Jordan, the east of Jordan, middle of Jordan, and the south of Jordan. And for the gender sample, we did female-headed cases and male-headed cases. And what we were really looking at there, on the one hand from the geographical sample, was to be able to check the modeling and make sure that we were not seeing significant differences in the population characteristics between the different geographical areas. If there had been significant differences, then we would have had to have different econometric models for each area. And for the gender sample, to check some of the initial analysis, which suggested that female-headed cases were not in and of themselves more likely to fall into the most vulnerable category. They were spread more equally across the different categories of vulnerability. So we developed a baseline survey, and what we're going to look at now is the results of that initial baseline survey. What you can see at the bottom of this slide is some of the heat mapping that we are able to do on the basis of the VAF surveys. So what we're seeing here is the northern area of Jordan, and this is an area around Irbid, for those of you who are familiar with Jordan's geography, and this is the wash tree. So on the left-hand side, you can see the heat map for wash, and then as we go across from left to right, those are the components that make up the wash tree. Excuse me for a second. Okay, so as I said, working in conjunction with the World Bank, we developed this econometric model, and we used that model to predict welfare. This is the result of that baseline survey, and here we're seeing 86% of the Syrian refugee population living outside of camps in Jordan are falling underneath the Jordanian poverty line. The Jordanian poverty line is about 68 JD per person per month, with the absolute poverty line being 28 JD, so abject poverty line being 28 JD per person per month. Nicole, 68 JD per month is about $70-something, no, 80, 90-something dollars. Anybody? About $100. Yeah, approximately $100 per person per month. The different aspects of this econometric modeling are there at the bottom, and there's no surprise here. We were pleased to see that these were sort of in line with the different aspects that had been identified through the consultations with sector experts and also with refugees themselves. So the size of a case, the larger the case, the more vulnerable a family is likely to be. The proportion of children. House crowding here is measured by the number of people per room. Occupancy type. Occupancy type here is whether or not the family is renting, the accommodation has been donated, or it's an informal occupation. The gender of the principal applicant, so the gender of the head of case, does have an effect on the econometric modeling, but it's not as strong as some of the other aspects. Interestingly, marital status was one of the aspects that came out of affecting vulnerability, with those people who are married rather than single or widowed being more likely to be more severely vulnerable. Formality of entry. affects vulnerability with, and this again is no surprise, those people who came in through formal borders, particularly those people who came in through the airport, being less likely to be severely vulnerable. And there was also some correlation with the governorate where the refugee was registered. What you're seeing here is some analysis of the crossover, so the correlation between the predicted welfare and the different sector vulnerabilities. So those cases who came out as being highly and severely welfare vulnerable, they're falling into the most severely vulnerable categories, and those are the ones who are living underneath that 68 JB per person per month threshold, have the highest chances of being severely vulnerable in the other sectors. There was 100% correspondence between severely vulnerable for predicted welfare and WASH, food, education, and basic needs. There were slightly lower levels of crossover between dependency, shelter, coping mechanisms, that's the use of negative coping mechanisms, or health. We are continuing to do this analysis and to really dig into the data. One of the things that should be noted here, and this is something that Andrew mentioned at the beginning, and it's perhaps something we can talk about in the questions at the end or in the discussion at the end, is what the thresholds that we were using here were based on the Jordanian poverty line. Now we understand from our experience in survey work that the Jordanian poverty line does not necessarily correspond to the lived experience of Syrian refugees. They have a slightly different experience to Jordanians who are obviously nationals. And so we have developed the MEB, the minimum expenditure basket, and that is something where if we applied the minimum expenditure basket threshold instead of the Jordanian poverty line threshold, we would actually see far more of the Syrian urban refugee population falling beneath that threshold. So where previously we were seeing 86% of the population falling below the Jordanian poverty line, if we applied the MEB, we would see over 90% of the Syrian urban refugee population falling below that. This is another type of visualization of what we can do with this analysis, and this we can do at a case level. So for every single case that we visit, we are able to do this level of analysis. What you're seeing here is an example of a moderately vulnerable case. This is a 32-year-old Syrian female living with a brother, one child. She has high levels of expenditure with only moderate levels of debt. If you look at the vulnerability circle in the middle there, what we're seeing here is on the left we have the universal indicators, and these are things that each and every sector pulled out as being aspects of the vulnerability in their sector. So each sector identified predicted welfare, that is predicted expenditure, and the economic status of the household as being a contributing factor to vulnerability. Also documentation status, whether or not they were holding valid UNHCR registration documentation and valid Jordanian government documentation, whether or not the family were using negative coping strategies, they'd reduced their food intake, they'd sold assets, they were sending children out to beg, etc. And the dependency ratio, the number of able-bodied adults with children or non-able-bodied adults. As we go around the circle, these are the different sectors that we have vulnerability trees for. That's the basic needs or non-food item sector, the education sector, food security sector, health, shelter, and WASH. What we don't have within the vulnerability assessment framework is a protection sector tree. And this was something that was discussed at length with the protection sector and our colleagues. And it was decided that a household survey methodology, which is ostensibly sending relatively junior staff to do household data collection was not necessarily the most appropriate way to collect protection-sensitive data, and a protection tree was not appropriate for this methodology. At the end, I will share with everybody the vulnerability assessment framework page on the UNHCR Syria data portal, and on that we have different guidance notes, and the protection sector is currently developing a guidance note which will sit alongside the vulnerability assessment framework and will speak to how protection lens should be applied when using this framework. On the right-hand side of this slide, I'm not going to go through this in detail, but you can see the different aspects of the trees broken out. So if we're thinking about this 32-year-old Syrian lady, she has a predicted expenditure of 129 JD per person per month, and that makes her only moderately vulnerable. You can see as we go down the list, she's not educationally vulnerable at all, and that's because her child is not yet of school age. So for the education vulnerability, it is only applied to those families who have school-age children. At the bottom there, for example, we can see that she's also moderately vulnerable for shelter, and there, in this particular case, she has no missing items in terms of the housing conditions. The security of tenancy is okay. She has a contract. It is affected by the fact that she has some debt, but she is, as we move across to the right, also moderately vulnerable because she is a female head of family. And the shelter sector, for example, identified that it is more difficult for female heads of cases to secure formal rental agreements because landlords are cautious or reluctant to rent to women who are living alone. This is another example, and this one is a 34-year-old Syrian man living with his mother, no children, and has high expenditure with no debt. Similarly, you can see that the changes in color as we go down the side on the right. If you look at shelter there, we're looking at family composition, and in this particular case, we have a non-autonomous adult. So, although there are no children, there is an elderly mother, and so the dependency ratio in this case is poor. Here we start to see some changes. In this case, we're looking at a highly vulnerable case. And what we're seeing here is a 48-year-old disabled female head of house. She has no children, and she's living with an elderly father. You can see that whilst the predicted expenditure for that case is still has them as moderately vulnerable, 79 JD per person per month, they are facing some severe vulnerability in the areas of dependency ratio. They have two people who are they have no able-bodied adults. They have the basic needs. They are already using emergency coping strategies. They have that difficult dependency ratio, and they're reporting high debt per capita. So here we're moving on to a severely vulnerable case. In this case, we've got a 38-year-old widowed Syrian female, and she's living alone with 4 children. Here at the top, the predicted expenditure there is, puts her into the highly vulnerable category. That's 43 JD per person per month. But you can see across the right-hand side of the table there, in the majority of other cases, she's coming out as severely vulnerable. Her documentation status is severely vulnerable. She's using those emergency coping strategies. The dependency ratio is poor. Basic needs is also severely vulnerable. In education, she's only moderately vulnerable, and there we see we've got 3 school-aged children. They have missed 2 years of education, but she does have 2 of those children attending school. Here we have an example of a severely vulnerable male male-headed case. This one is a 41-year-old Syrian man living with his wife, 4 children, and elderly mother-in-law. And you can see just from the vulnerability circle there that they are severely vulnerable in all instances, apart from in WASH and education. And I have a question coming in. So we have Ellie who's asking that the protection sector is not reflected in the vulnerability assessment, and can I state what the action points taken to address this are? Okay, sure. So the protection sector is currently in the middle of developing a guidance note, which will sit alongside all of this, which will advise on how the protection lens can be applied across this. And I'll come back to that a little bit more maybe when we talk about targeting, and Nicole talks about the experience with WFP. So that's one point. And the second point is we're talking to and thinking about whether or not a protection tree can be developed that would only be applied by those agencies who have protection trained professionals doing data collections, so where it is case managers or other staff members who've had the appropriate training who are doing the data collection. I hope that helps with that question. This again is then looking at what we can do with all of this information. There's the vulnerability circles and tables that you were looking at there relate to the case level. This is where we can both drill in and drill out, if you like, from the case level. And this is basically heat mapping. So what we're seeing here is the area in the east of Jordan around Mafraq. Mafraq is very close to Zatari camp, the largest refugee camp in Jordan, for those of you who are not familiar with that. And you can see there that the Mafraq town is the concentration in the middle of the map. And you can see the way that the different elements of vulnerability are being broken out across the area. So top left, we have documentation vulnerability. Top right, we have dependency ratio vulnerability. Bottom left, coping strategies vulnerability. And bottom right, predicted welfare. And this is I'm going to show you just really quickly a series of these maps. The maps are all online. They're all on the data portal, so you can go in and have a look. But these are really, we think, key for being able to help agencies with planning, with advocacy, with thinking about where in Jordan they might want to focus their efforts. It also allows us to look at, and this is where collaboration and coordination comes in, it allows us to look at where there are hotspots of vulnerability, what are the aspects that make up that vulnerability, and then what services are available. We've also shared these maps with the government of Jordan, and they are using them as part of their own needs assessment, and looking at where there are shortages in, for example, the provision of schooling or hospitals, and we can see if there is a correlation between levels of education, health vulnerability, for example, and service provision or lack of service availability in those areas. Here's just one so we can drill in a little bit more. We're looking here at the basic needs vulnerability across Mafraq, and you can see the high concentrations of Syrian refugees living around Mafraq city. If we go out to the right there, I think that's probably Zatari village, just on the sort of corner above where it says Mafraq Governorate. And so those are high concentrations of very vulnerable refugees living just outside of the refugee camps, for example. Again, each of the maps for each of the sectors has the different components around the bottom. Just to flick through quickly for you, here's the distribution of food vulnerability across Mafraq, and again, the different components: health vulnerability, shelter vulnerability, WASH vulnerability. Okay. Now, in addition to having done all of this work, the vulnerability assessment framework results and scores were also something that UNHCR, UNICEF, WFP have all used to help inform their targeting for assistance provision. And increasingly, we're in discussions with different partner agencies and INGOs about how this wealth of information and analysis can help inform their targeting and ensure that we're providing assistance to those who need it most. I think Nicole will talk for a couple of minutes about what that looks like in the case of WFP and how they've used the VAF information to support their targeting of food assistance, and then we'll talk about the importance of an appeal system when using modeling to make decisions about assistance eligibility.
Thanks, Kate. So a little bit of background first of all. Up until October last year, WFP was assisting 98% of the Syrian refugees in Jordan that were living in the host communities. With the VAF, the assistance of the VAF, as well as our own internal assessments and understanding of vulnerability to food insecurity specifically, we moved towards a more targeted approach of food assistance in October last year. In the initial round, we cut around 7% of the beneficiary population, which equated to around 12,700 households, around 37,000 people. And with that, because really we're cutting on a modeling system, to understand that there can be outliers, there can be characteristics of the family that is not immediately available within the model or not captured, and also to understand the intra-household dynamics. So when we're targeting based on the case registration data, but to analyze who they're living with and other factors that are outside the case that are impacting on the vulnerability to food insecurity of that specific case. So in order to do that, under the auspices of the VAF, we created an appeal system. And it was a very interesting process. It was certainly a lot of learning on all sides. It was done with the involvement of the VAF partners, in particular one of the INGO protection partners was very active on looking at how these decisions are being made. And just a couple of quick learnings on that. Establishing what the criteria is and how it interacted with the VAF score and what other factors need to be taken into consideration and how, in as simple and objective manner as possible. It's a real challenge when it comes down to identifying the vulnerability of an individual case, particularly when you're dealing with something like 6,000 appeals, as we were initially. Around half those households that were cut did appeal. And then how to have the system in place to be able to review and analyze those appeals as quickly as possible, noting that during this process, beneficiaries were no longer receiving assistance. And it was a difficult process. Now, under the VAF, we piloted the portal, the sample of which you can see on the screen. And this, again, was certainly an evolution from the initial pilot as we learned of the different situations and review processes that needed to take place in order to reach a decision. And then to deal with the large number of appeals, we also had a UN Ops team that we had online from January until August to review the appeals. Keeping in mind we did a second round of targeting in April where an additional 47,000 appeals were received. So that team has been reviewing these appeals, as well as our VAF colleagues have been running additional modelling separate from the original VAF modelling, looking at correlations specifically on food security.
And then, the one thing to say about, in addition to Nicole's comments there on the appeals, is just in terms of what do we do in order to look at an appeal. So People were being removed from food assistance on the basis of the modelling, as we said, so looking at where they fell in terms of predicted welfare vulnerability. When we received appeals from refugee cases, we were then doing a much more involved process of review, which is similar to what you would do for a case management review. So using the full home visit data, and the full home visit data does include some of the protection data that we had not included in the vulnerability trees, potentially. We were also referring to information received from other partners and from field units. So just to give a sort of concrete example of what this might look like, we could have received an appeal from Abu Ahmed, who is a 45-year-old Syrian man who has 2 disabled children, adult children, 1 adult male child, an infant, and his elderly mother-in-law living with him in addition to his wife. Some members of his family may have been cut from the food assistance because they are not registered on the same case, and some members not. And the appeals team would go in and look very carefully at all of the data and the information that was being housed on that particular case. They would then, in addition to that, call the case and ask them about their food security situation and what coping strategies they had been employing to be able to meet their food security needs. And if, having exhausted all of the different avenues of analysis, if we still didn't have enough information to make a case decision, we would recommend that the WFP appeals team would refer the case for an additional home visit. So it was really an extremely robust system for being able to look at and assess whether or not people were eligible for assistance or eligible for re-inclusion in assistance. We have one question coming in here from Robert, and yes, you did hear correctly. That was 47,000 appeals.
Yes. So in the second round of targeting, we've had significant funding challenges this year. Through the first round of targeting and also verification processes, we were able to reduce our caseload down to 85% of the overall population in the host community. We reduced it further in April, as well as shifting to a tiered assistance. So instead of giving the same level of assistance across the whole population, we were able to give those that had a VAF score that put them at extremely vulnerable, 20 JD, and those that had a VAF score that put them as still vulnerable, but less so, they were getting half the original planned assistance at 10 JD. That was the plan, at least. Those that received the 10 JD or half assistance were able to appeal. And this half assistance affected 220,000 people, which is why we had such a high level of appeals. In addition to that, we also had removed further people from the assistance, so they were also able to appeal. So we had 2 lots of people appealing, which is why we had 47,000 appeals. But then, like Kate was saying, going back and going through the modelling, we did a lot of re-inclusion based on the modelling, and then focused our attention on those that were not originally re-included through additional modelling for the robust appeals process. Accepting that we were more comfortable wearing a higher inclusion error than a higher exclusion error.
And we have another question coming in that I'll respond to in just a second, but we really wanted to highlight this for colleagues who might be interested in a similar process in other areas, is yes, 47,000 appeals is a terrifying number, and there is, nobody's pretending about that. WFP were the only agency in this operation who were providing blanket assistance to the urban refugee population. All other agencies who are going to be using this methodology to help inform their targeting are going up rather than down. So they are looking at who they can include in assistance rather than who they can remove from assistance. And so one of the things that we have been talking about with other colleagues in the region who are doing similar processes and thinking about appeals processes is that in general for this kind of process where you are cutting very, targeting and then cutting very large numbers of people from assistance, this very heavy appeals process may not be the most appropriate methodology. It is probably a best practice in terms of being able to respond to the actual needs of the refugees, but it is of course extremely resource heavy, and that needs to be factored into any programmatic decision making. What we are looking at and talking about now is referral mechanisms which allow partners, community partners in the field to make referrals on the basis of vulnerabilities that they find during their field work, rather than having refugees themselves come through and make these appeals for their cases to be reassessed. We have a question coming in from Anna. And Anna's question relates to the fact that the studies show that almost 90%, and if we use the MEV, over 90% of refugees are vulnerable. She's asking, was this not evident before the study for our field community service colleagues? Absolutely, Anna. I think it definitely was, and there were other studies that had shown that. What we just wanted here was to be able to validate those findings and then be able to map it across the country. And the second part of Anna's question is absolutely the crux of the last part of our discussion, perhaps, which is what on earth do you do when you find that you have over 90% or almost 90% of the population falling into those extremely highly or extremely vulnerable categories? Nicole has raised her finger at me. Go ahead.
Yes, and just following on from that, when in an ideal world we would have sufficient funding to assist the 90% of refugees that are vulnerable, economically vulnerable, or vulnerable to food assistance from my WFP perspective. When we are struggling with funding challenges, it's using this more graded approach in how we can prioritise those that have the greatest identified need for food assistance in what is in fact quite an objective manner. Now, it does not mean that those that are less vulnerable do not need assistance. It's how we're prioritising the resources, with also the risk of those that are not receiving in the following prioritisation of their vulnerability status then changing over time with the lack of resources.
And just to go back, and we've got another question that's going to come in about the appeal, so we'll take that in just a second, but just to go back to how we might be able to apply all of this to targeting of assistance. The predicted welfare model allows for a continuum, so it's a zero-up scale. So within that extremely vulnerable category, so those falling beneath the 28 JV, we can grade that and put in as many thresholds as we like. We can change the threshold. We could decide that the threshold was 10 JD if that was appropriate and based on a sectoral level decision, for example, which allows you to do various types of gradation. In discussions with the Basic Needs Working Group, for example, we've been talking about how you might look at the predicted welfare and the basic needs and look at those gradations, but also the need when thinking about providing assistance to go back and really dig into these sector trees and pull out the different components, so the aspects that build up the sector tree, and think about where we can put in additional thresholds, because yes, it is understood, and the question is extremely pertinent, that we are not in a position to provide assistance to 90% of the urban refugees, unfortunately. So Anna, on that one, hold that thought, and hopefully we will be having some additional guidance come out on that.
Okay, and the next question that we've received is, it's from Stephen. If I may ask the question about the appeals process, does the review team, hang on, technical problem. Okay, does the review team look into each case, or there's a bulk methodology? Initially, we were actually reviewing each case, and part of that was to look at to understand why people were appealing and what the justifications were. Through that initial process, we developed criteria for re-inclusion. Some of that criteria enabled us to do bulk re-inclusion, and so there was basically a bulk re-inclusion. And in the second round, there was, within those that were receiving the 10 JD, there was also a bulk, I won't say exclusion, but a bulk of keeping that group at 10 JD, or at the half assistance level of the vulnerable group. That then left a significantly lower percentage of appeals to actually review. Like I was saying, we really wanted to minimize the exclusion error, so it was those that were most likely to be excluded that we then ended up reviewing at the end of the process. I hope that's sufficient for that question.
Okay, and I think that's about it. So as I said, the WFP, and we've just heard about that, has been using the VAF to inform their targeting, and again, this is about the reduction of assistance, not the inclusion into assistance. UNHCR is in the process of looking at how we can use the VAF model for eligibility decisions around cash programming, and this is again looking at how we use those predictive welfare scores for yes/no eligibility decisions. UNICEF has already been using the VAF model for eligibility decisions on dispensing cash assistance, which they use the UNHCR cash distribution mechanism, and that's being given to vulnerable families with children, school-aged children. And as we speak, we're in the process of doing VAF training for INGO partners who will now start contributing to the VAF data collection. And this is something that, as I said at the beginning, we've had over 65,000 visits. That's about just over a third of the urban refugee population has been through the VAF process. And we're now having INGO partners come on board and also contribute to that VAF data collection. They've been trained to use the OBK devices, and they will start having their teams go out, collect VAF information. That VAF information will then be shared back with them so that they can make decisions about whether or not families in their catchment areas or in their areas of operation are eligible for assistance. I think that's it.
Any further questions?
Okay, we're getting a couple of different questions coming in. So we've got Eleanor. How is family vulnerability related to individual vulnerability? No. And this is a good question, Eleanor. So for the purposes of the VAF, and this was something that was talked about a lot within the steering committee and with partners, this is case level vulnerability. The methodology is not designed to capture the individual vulnerabilities, and this takes us back again to some of those protection guidelines that sit alongside, or need to sit alongside this, and the protection lens that needs to be applied is methodology is not designed to capture vulnerabilities that might be specific within a family. So whilst we will be collecting information that might say we have a disabled individual within this family, we would not, through the VAF analysis framework, automatically capture that. The information is there, and there are other types of analysis that could be applied to the data collection and the data that we have. So that's not being captured as we speak through the framework. And then we have Ricardo. Seeing how complicated the mathematical formula appeared on the screen, would replication be possible without demanding high-tech technical skills and their related costs? So, Ricardo, in order to replicate this, an operation would need an econometrist to come and do the statistical regression. What we have available in Jordan is we have really excellent documentation. We were very lucky to have a team member who was a fantastic documenter, and we can certainly share all of the methodological points that sit behind how you would do this piece of work. But yes, you would need an econometrist to look at your data set and run those statistical regressions. Related costs, you would probably need somebody with that skill set for about a month, and that would be a mid-level professional, so whatever the related costs for your operation are.
Over.
So we've got Errol here. Has the data collection helped to generate additional resources so as to reinstate assistance to some persons upon the completion of their appeals? Nicole's going to take this one.
So in the process of reducing the number of beneficiaries, we allowed for the re-inclusion of a percentage of the beneficiaries. Obviously, the more, when you have a finite amount of money coming in, the more people that are then re-included, the less length of time you can continue the operation. So this is the playoff. In terms of whether it assisted to generate additional resources, it certainly was something that the donors wanted to see us being engaged with and implementing. I think that it has struck very well with a number of donors, our ability to tier our assistance so that the most vulnerable are receiving more assistance. We've certainly had some positive feedback on that. So in that way, yes, it has certainly benefited us in footfalls from the fundraising, but fundraising does continue to be a challenge.
So we have another question coming in from Livio. How transparent is this process with the population, so our persons of concern, in terms of explaining the system beyond the decision of whether to include or exclude a refugee family? We actually have in the room with us, who's been completely silent, Abdullah, who is our Star Trek techie, but he is also the person who works very hard with partners and with our implementing agencies on the questionnaire and the data collection process. And something that he has been working on recently a lot is, one, a consent form, and helping the people who go out and do the data collection really be able to explain to beneficiaries or persons of concern what it is that they are consenting to in terms of having their data shared and how that data will be shared, and what agencies might do with it. So I come into their house and ask them a bunch of questions, and really helping them to understand where that information will go, and that it will be used by agencies to help inform decisions about targeting of assistance. We have also, within that, the data collection form has information about where refugees can register complaints, who they can call, and the help desks that they can call in order to raise concerns either about the process or about what has happened to their data. Both WFP and UNHCR have telephone help desks which receive multiple calls from beneficiaries on a daily basis, asking about decisions around eligibility, and the help desk staff are familiar with how this process is running. And during the process of WFP's food targeting, beneficiaries were receiving text messages that informed them about whether or not they were going to be included in assistance. And those text messages also included information about the help desk numbers for both UNHCR and WFP, and information about the appeals process. All of WFP's implementing partners, in addition to UNHCR field help desks, had information booklets about the appeals process that they shared with beneficiaries, and there were appeals forms shared both through Twitter and Facebook. So there were quite a lot of different ways in which we were trying to reach out to the community and ensure that to the degree possible they did understand what was happening. Did I miss anything?
No, I think that's covered it.
What have we got?
The minimum size.
Okay, sorry, we also have a hand raised here.
Okay, a hand raised. Yeah.
Okay.
Felix, the floor is yours.
Yes, thank you. I just want to find out, what do you recommend? Do you want, for example, that in an operation where we already have refugees living in the urban area for long, that we do a baseline VAF, or we try to piggyback on the regular home visits that we do? What will be our recommendation? And then, can this model, can this approach help us in targeting assistance, say for microfinance, to know which categories of people will be able to reimburse, or will not be able to reimburse?
Okay, great. First, I can hear myself on echo. That's really funny. First question: yes, you would always need to do a randomized representative sample across a refugee population. Because of the various biases, and that unless you are collecting already randomized representative information, then the information you have is almost certainly likely to be biased towards vulnerability. So yes, you would need to do that baseline survey in the first instance. And the second part, and that doesn't have to be huge. If you have a homogeneous population, the average or sort of standardized survey sample is usually around 400 cases. So it depends on the size of your population, but it doesn't have to be a sort of 10,000 household survey. In terms of microfinance and the types of assistance or programming that you might want to design, yes, you can start to look at you could use the similar analysis to look at predicted welfare. You would have to do some slightly different analysis, I think, to really be able to think about microfinance and those types of programming which come under perhaps refugee resilience programming rather than humanitarian assistance. But one of the things that our colleagues, for example, in Egypt have done, and we're about to do in Jordan, is a gap analysis, where having identified where people are in terms of predicted welfare, they are then also looking at the food assistance that families are receiving and the cash assistance that families are receiving, and doing some analysis on where that takes them to in terms of the minimum expenditure basket. So there you would be, if you did that kind of analysis, you would be able to look at, okay, this is the section of the population who are really in need of assistance in order to be able to reach the minimum expenditure basket, but this is the section of the population who are more or less stable, and those might be the section of the population who you would want to target with microfinance or microcredit and other types of resilience programming. Hope I answered that question. We had a question here from another question from Livio on, is there a minimum size of the population to assess to make this process efficient? I actually don't know the answer to that. I haven't given, I mean, it is a time-consuming process. If you do it, what we have done here, which is to go through all of the different sectors and all of the different aspects and to ensure that that is an inclusive process. If you wanted to do what we were calling VAF light, which is just the econometric modeling. As we said, you would need a baseline survey, you would need an expenditure survey, you have to have something which allows you to calculate the costs, and you will need an econometrist. I think as long as you have a population of refugees that's in the tens of thousands, I don't see why that population wouldn't warrant that exercise. Nicole's nodding at me.
It is a tricky one, particularly with the how often do you update that against the baseline, and what are your key indicators then for when there is significant change to the point where you want to roll out a greater number of household visits to look at the individuals, or to update the modelling based on a revision of the key indicators for the welfare. I think that's what I would add to that. We've got another question coming in, which is on how did you deal with fraud? I just want to for that. Yeah, we've gone from Ephraim. As vulnerability evolves over time, whether higher or lower, how does the VAF cater to this, and what's the plan by Jordan to update the vulnerability data? Excellent question. Right at the moment, we are in the process of doing a second tier of the baseline survey. One of the reasons for this is that we understand that there are seasonal differences that refugees experience. So the previous baseline was run in January and February. This is a summer baseline, and we're looking at we're doing 2 stratas, and one of those is we will go back, or we are going back to families who were interviewed in January and February to see how their situation has changed. This is also in light of the WFP food assistance targeting, so we will be looking at those families who we'll be doing a comparison between those families who have had food assistance removed and those families who have continued to receive food assistance. And we will also be doing some analysis of whether or not families were included for other assistance packages over that time period. What we are talking about is being able to continue to do those baseline updates every 6 months. So doing a small sample randomized survey over time, and also doing plain data, and that, what we mean there is going back to the same families over time. So while we're doing another round of the surveying now, we would be looking to do another round of the surveying again in January and February of next year, funding allowing. Now we've got a question. This one's from Alex, and this is also a question that was talked about a lot. It was talked about within the context of the VAF, but previously also within the context of the UNHCR home visits. And the question here is, how did we deal with fraud problems during data collection and verification, and in particular for the economic vulnerability? Alex is asking and being concerned around debt and that being self-reported, whether we're using a proxy indicator. How did we deal with refugees refusing to disclose information on their income? If this data was collected in okay, so lots of different aspects of that. There are a number of things with fraud, and some of those are technical solutions, for example. I'm looking again at our colleague Abdullah across the other side of the room, who has built into the ODK device itself and the questionnaire itself a number of different safeguards around fraud. So you can do some really quite magical techie things with ODK devices. For example, you can measure the amount of time it takes for the interviewer to go through different sections of the form. So if I'm a fraudulent interviewer and I've decided I am just going to conduct interviews on the telephone and I'm just going to make up the answers, the device itself actually tracks that, and we have a system in place to be able to look at the periods of time that an interview takes. Similarly, we can capture the location, so the GPS point. So if I'm a fraudulent interviewer and I've decided that really I want to be drinking coffee and smoking cigarettes in a cafe, the GPS point would alert us to that. So there's some interesting technical solutions to some aspects of that. That's on the side of interviewers potentially having fraudulent or exploitative intentions towards the beneficiaries. On the other side, with the beneficiaries, the econometric modeling in itself is the methodology for using proxies and for being able to look at some of those issues around debt or underreporting on income or overreporting on expenditure. And that's the methodology that we use to get around that. So if we look back at our VAF records, we have, I think, over 10% of cases who are reporting no income at all. We have some interesting outliers in terms of debt, and it is that statistical regression and the modeling which allows for
the development of the characteristics of vulnerability. So that's partly dealt with there. The other thing that's actually very interesting in this context, and it may not be the same for everybody everywhere, is in general we have had almost no problem with people reporting on income or people talking about debt. And this is through the home visits. Abdullah's nodding at me. This is through the home visits, through the VAF data collection, but also in terms of, if you remember I said during the appeals process, we also called refugees and asked them questions about how they were managing. And honestly, to my surprise, people were remarkably open and saying, yes, actually, my husband is working and earning X amount of money, or my cousin is sending us money from Dubai. With this particular population, at this time, we have had really, I would say, very, what would you say, very accurate, relatively, reporting on expenditure and income from the beneficiaries. Okay, we've got Ibrahim. As vulnerability evolves over time, whether higher or lower, how does the graph cater to this, and what is the plan by Jordan to update the vulnerability data? I think, Ibrahim, we more or less covered that. So we will be tracking through those baseline surveys the changes in vulnerability over time. And we will be doing these bi-yearly reassessments of the same population and bi-yearly assessment of new populations samples. I hope that answers that question. Anybody else? Attila, do you have anybody waving hands at you that we can't see?
No, Kate, I don't see any hands. No, I don't see any hands, yeah.
Okay. So as I said, that's it. That's the Jordan Vulnerability Assessment Framework. I hope you've all found that useful and interesting. My email is washing, WASHINGK @UNHCR.org. And you're welcome to send any questions or thoughts or comments to me. We also have the, I'm being asked to do two things at once, talk, type, and use technology. We also have the VAF page on, as I said, the UNHCR Syria portal. I'm not going to type the address for that now, but we can certainly share that through the invitation mailing list. And we're very happy to take any thoughts. Oh, we've got Rasmus. When deciding on whether an individual indicator should be included, do you look at significancy levels or also size effects estimates and regression analysis, and what about confounding of the relationship? Yes. So Rasmus, when we were working, there's the two different elements. One, we have the econometric modeling, which is looking at the statistical regressions and the relationships and the coefficients and the power of those different characteristics, and that's the math. But on the other side, when we were looking at the food sector trees, the sector trees, including, for example, the food sector tree, yes, one of the things that we did during the review phase, the review and validation phase, was to go back and look at the instances of reporting, look at the relationship between the different aspects that build up those different trees. And for each different sector, as I said, there were decisions made about whether to use maximums or averages, and how different elements of the different sector trees build into that ultimate vulnerability score. For example, in shelter, if a family is living in an informal tented settlement, that is automatically a 4, regardless of what any of the other components of the sector tree would be. So it's automatically a severely vulnerable And so we looked at that and tweaked those with each one of the different sectors. Does that answer the question? What we didn't do, and it's something that we could have done if we'd had more time, would have been to do a full regression analysis on all of the different aspects of all of the sector trees. And I'm looking at significancy and sizing there, and that we did not do. Okay. Well, thank you everybody for coming. It's 6 o'clock in the evening on a Thursday evening in Jordan now, which is the end of our working week. For those of you that it's not the end of your working week, I hope you have a good Friday and everyone has a lovely weekend. Thank you very much.
Thank you.
Thank you.
Oh,